Here we go. Go on.
Hold on 2 seconds. Hi, my name's Leesa. My student number is 186-12253 and I'm a RN student, and I'll be doing a Schedule 8 medication administration. Okay. So I'll wash my hands. Okay, and I have a Mr. Peter Pitt, and I'm just reading the notes. 72-year-old man who has had a pedestrian accident walking across the crossing, and he's got right rib abrasions and wound to the left leg. The doctor has ordered him for some pain relief, BD, which is oxycodone. I can see that there is an order here. It hasn't yet been given, and I'll validate that order in a moment, but it's for Peter Pitt. And he's allergic to penicillin, but I'm just going to go and check the patient's identity. So oxycodone 7.5, and it hasn't been given. It's also ordered for some paracetamol as well. Cut. Hello, Mr. Pitt. How are you going? Yeah.
I'm fine, thank you.
Good. My name's Leesa. I'm a student RN, and I'm looking after you today. I've heard you've been in a little bit of an accident. How are you feeling now?
I'm feeling a bit pain.
Oh, okay. And so doctors ordered you some pain relief.
Yeah.
First, what I'll do is I'm just going to check your ID, and I'm just going to do a pain assessment. Is that okay?
Yep.
Sure. Okay. Can I just get your name, please?
Peter Pitt.
Yeah. And your date of birth?
1st of the 1st, 1945.
Are you allergic to anything, Mr. Pitt?
Yes, I am allergic to penicillin.
Yeah. And what happens when you take the penicillin?
Oh, when I take penicillin, I get rash on my body.
Oh, really?
Yeah.
Okay. Well, the doctor's actually ordered you for some oxycodone. You're not allergic to that, are you? Nope.
No.
Okay, so it's for penicillin, and so I've noticed you haven't had that. You said you're in a bit of pain. If 0 was the no pain and 10 was the worst pain,
Yeah.
how much pain would you be in, Mr. Pitt?
Out of 10, I got 8 pains.
Oh, about an 8, is it?
Yeah.
Okay, so it's quite a severe pain. This oxycodone can really help with that. And where is the pain?
Oh, I got pain on my left chest.
Yeah?
Yeah.
Okay, all right. So, yeah, okay, so you've been in a little bit of an accident, so the pain's there. So I'm going to grab you this oxycodone. It can make you feel a little bit nauseous, a little bit dizzy.
Yeah.
It can actually cause a little bit of hypertension, which is low blood pressure, cause you to be a little bit dizzy, and sometimes can make you feel a little bit sick. So what I'm going to do, I'm just going to measure your blood pressure now, just to make sure that it is within range before I give that. Is that okay with you?
Yep.
Okay, just going to check that blood pressure now, respirate, just to make sure that everything's in line with your vital signs. Okay. Yep, it's all in date. Okay, yeah, it can also cause you a little bit of a dry mouth, so I'm going to be just monitoring you throughout giving you this medication. Is that okay?
Yep.
Okay, here's your buzzer. If you need anything, please call out straight away, but I'll be back in a few minutes with that medication.
All right.
Okay, I'm just going to validate the order. Do you mind to do my checker, my second, to validate my order?
Yep.
Is that okay with you?
Yes.
Okay, so we have a Mr. Peter Pitt,
Yes.
date of birth 1st of the 1st, 1945.
Yep.
I've just validated I've just checked his identity with his armband.
Yes.
He's allergic to penicillin. It does give him quite a bit of a rash, and it's been signed by the doctor.
Yep.
He's been ordered, it's in date, it's in the right date, oxycodone,
Yeah.
oral, so it's the right route, 7.5 milligram twice a day for pain. It's been signed, and it's got the doctor's name, order, all signed by the doctor, and it's got a contact detail as there.
Okay.
It hasn't been given for today,
Yeah.
and that's the 8 o'clock dose, and there's another dose there tonight as well. He's also ordered for some paracetamol, which I'm not giving at the moment.
Okay.
Just validating that order. Are you okay with that?
Yeah.
Okay.
Yeah.
Now, oxycodone, if I'm looking at the MIMS,
Yeah.
so I'm just going to have a look at the MIMS. Okay, so I'm turning to the Yep, to the MIMS page. Now, it's a opioid analgesic for moderate to severe pain, and he's told me that he's got a pain score of 8. It was quite severe. It can cause respiratory depression, arrhythmia and hypertension. So I'm just going to be monitoring that. Can also make him a little bit dizzy as well. I've just done his vital signs, which are all within range. So I'd be comfortable to give that. Are you happy?
Yep.
Yep, okay. The starting dose is 10 milligrams start dose, and he's having 7.5 milligrams. So that's actually within the required dose. It's orally, and it can cause a bit of GI upset, dry mouth, sedation and confusion, so I will need to be monitoring Mr Pitt quite regularly for respiratory depression and hypertension. Are you happy to come with me to get that medication
Yes.
out of the drug cupboard?
Yes.
Okay, so we validated that order. Okay, so now we're just going to grab that out of the cupboard. Okay?
Okay.
All right. Right, I've got the keys on me.
Yep.
Okay. Just leave that there. Okay. Just wash my hands. Okay. All right. So, oh, a bit squeezy here, isn't it? A bit squeezy. Okay. So what I'm going to do first is I'm just going to get the drug book out.
Yep.
Okay. So I'm going to turn to the order. So are you okay to be my second checker?
Yes.
My RN?
Yep.
Okay. All right, great. All right. So we have oxycodone, which is endone. Its
Yep.
name, the trade name is endone. So it's 5 milligram. Okay, and it's in page number 47, 48. 48, yep, okay. All right. So I can see that that is there in the drug book, but what I need to do first is I need to just check that there is the amount that says it's in the cupboard, okay? This is a Schedule 8 drug book, which is a legal document, so I need to just make sure that it is all correct and it all marries up before we do the drug checks. Okay with that? Okay, so I'm just opening the drug cupboard. Yeah, okay. Alright, so you can see there's some medication in here. I'm just going to bring that out. I'm just going to shut the cupboard, and it's locked, but I'm going to be standing right here, so I'm right near that, so I know that I need to be with the drug keys at all times. And I'm just going to do this to make sure that there's enough, what it says varies up with the book. Okay, so we have these 2 sealed boxes, okay, and they've got 20 in each one of those. So I have endone, which is endone, okay, and it is also known as oxycodone, 5 milligram, expiry December 2020. That's 20, okay. Then I have another sealed box, okay, sealed bottle. So that's endone, that's oxycodone, same thing, same medication. Expiry 2020, so that's another 20, so that's 40. Are you happy with that?
Yep.
And here is the third bottle, which I'm going to be taking it out of. Endone, oxycodone, expiring 10/20. Okay, so we're just going to open that up and have a look. See how many are in that. Okay, now, don't want to put that on my hands for contamination. Okay, so no more in the bottle there. Okay, so we just check. So that's 20, 40, 41, 42, 43, 44, 45.
Okay.
Are you happy with that?
Yep.
Okay, so that's 45. So we're starting with 45?
Yep.
Okay, so Mr. Pitt requires, he requires 5 milligram as per the order. Yep, so oxycodone is, so Peter Pitt, he orders 7.5, and so stock required is 7.5 over 5, and he will be having 1.5 of those tablets.
Okay.
I'm just going to be doing the first drug check. Are you happy to do that with me?
Yeah.
Okay, so we have Mr. Peter Pitt, first 1945, penicillin, we've already validated the order. We have oxycodone, which hasn't been given, 7.5 milligram BD for pain. It's been signed by the pharmacy, signed by the doctor, and it hasn't been given. I've got 2 sealed boxes of endone, which is containing 20 each. Okay, so it's endone, oxycodone, expiring 2020. Second box, bottles, oxycodone, endone, expiring 2020. That's 20, that's 20, 40, okay. And that's 45,
Yeah.
okay. And so that is my first drug check. Okay. So now I'm going to be doing, I've done the calculations, and I'm wanting 1.5 tablets of those, as per my calculation.
Yeah.
I'm just going to do my second drug check.
Yeah.
Okay. So my second drug check, I've got endone, so that's the sealed boxes. So oxycodone, endone, expiry 10/20, hasn't been given as per validated order. Penicillin brush, that's 20, that's 40, that's 45, okay, and nothing in this box. Are you happy with that?
Yeah.
Okay, so he's going to be needing, as I said, that 1.5 tablets. So what I need to do is I will need to cut that tablet because he needs 1.5.
Yeah.
Okay, which would mean that I'll be putting 43 tablets back. There's 45,
yes.
and I'll be putting 43 back. So I'm just going to grab that cutter out, okay? I'm just going to get that all just unlocking the drug cupboard. Okay. Got a medication cutter out. I've got that. Locking the cupboard, that's staying nearby. Yeah. Okay, not going anywhere. And then I have so I have Mr. Peter Pitt,
yeah.
Mr. Peter Pitt, and I'm going to be taking out, okay, so 2 tablets, so 1 and 2.
Yes.
I'm going to be returning 43 tablets, okay, as per the book, and we'll fill that out in a moment. So I'm returning 20, 40, and that is 43 tablets. Are you happy with that?
Yes.
Okay, I'm going to be returning those to the drug cupboard. So endone, expiry 20/10/20, and I'm returning those 3 to the cupboard. Okay, expiry 2020. So 20, expiry 2020, expiry 2020, endone, expiry 2020, 43. Okay, so I'm just going to be unlocking. Yep, okay, I'm going to do, actually we're just going to do the third check first, before I put those back. I jumped the gun a little bit. But the third drug check, so we've done the first drug check, we've done the second drug check. So second drug check's already been completed, and now we're doing the third drug check, which is endone, 5 milligram as per the 7.5 milligram over 5 milligram. So he is having 1.5 tablets. So that's his order is 1.5. So we have oxycodone 20 in there, okay, 2020. Oxycodone 2020, that's 40. Okay, oxycodone 20, and we're returning 43. We've taken out 2. Okay, and I'm just going to be halving that tablet now. Okay, so they're scored tablets. I'm just going to be halving that tablet, putting it in the middle there. Okay, and halving that. Alright, so I have 1.5 tablets there. Okay, and then I'm just going to be discarding the other tablet. Okay, you happy with that?
Yes.
Okay, so now I'm going to be putting all my equipment back into the cupboard.
Yes.
Okay. 43.
Yeah.
So unlocking the cupboard. Put it back in. See what happens. Okay. It's back in the cupboard now. So I'm going to be holding this here. Okay. I'm just my pen's just fallen on the table. Yep. Okay. Alright. So we have so today is the 22nd of the 3rd, 18, and it is 14:30. So PP. So as per my calculation, 1.5, 0.5. Putting back 43, as you saw.
Yes.
Putting into the cupboard. It's ordered by Dr. Brown. Dr. Brown. And I'm just signing that it's given. Okay, and do you mind to sign that's the second checker as well?
Yeah.
Okay. Okay, great. All right. So we'll take a photograph of that in a moment. That's fine. We'll come back to that. I'm just going to go and give the medication to the patient. Are you happy to come with me?
Yes.
Okay, I'm just going to wash my hands. I can do in that. Just washing my hands. Okay. All right. Okay. So I'm just going to go over and do my second check for the patient. Okay. Second patient check. You come to me. Okay. Hello, Mr. Pete. I've got your medication.
Okay.
Okay. How are you feeling?
I still have the pain.
Yeah. Okay. I've got this. Hopefully that will help for your pain. I just want to do a second patient identity check. Could you tell me your name, please?
Peter Pitt.
And your birthday?
First of August 1945.
Are you allergic to anything?
Yes, I am allergic to penicillin.
Yeah, I can see that you've got a red armband, which indicates to me that you have the allergy. And you said before that that actually causes you a rash, is that right?
Yeah.
Peter Pitt, MRN 123754, 1st of the 1st, 1945, and you're allergic to penicillin. I'm just going to give you this medication. I'll just sit you up. And here's your water. I do need to see that you swallow this medication. All right, have you swallowed that?
Yes.
Okay, great. All right. Now, I'm going to give you your buzzer, and I'm going to come back and check in on you in 15 minutes, because as I said previously, it can cause you to be a little bit dizzy. So I just want, it can also cause a little bit of nauseousness. I want to check in with you just to make sure everything's going okay, and I will do another set of vital signs on you then. Is that okay with you?
Yep.
Okay, here's the buzzer. Okay, and if you need me in the meantime, please just sing out. Okay, thank you, Mr. Pitt. I'm going to dispose of the equipment. Okay,
Yeah.
dispose of the equipment. Yeah. Okay, wash my hands. The book is filled out. This book needs to stay here. Okay. This book needs to stay here in the drug cupboard the whole time. Okay, so that needs to stay in there, in the drug cupboard. Okay, so we've given that medication as per the order. So I'm just going to date that now and put the time in, 14:30. Are you happy to sign that with me?
Yeah.
Okay.